The Health and Wellness Show on 900 CHML now talks about something that perhaps people get a little shaky about to begin with, and that is the word cancer. Living with cancer, of course, can introduce some stressors in a patient's life. However, now when you toss in COVID-19 with somebody battling cancer, it can be a whole different world. And joining us to talk about that is a clinical psychologist at Massachusetts General Hospital, Dr. Jamie Jacobs. Dr. Jacobs, first of all, thank you for joining us. I know you and your team down there in Boston, Mass. are extremely busy.
Thank you, Ted, for having me. I think everyone seems to be busier now, and we're all just trying to provide our patients with whatever they need at this time.
You know, I'm curious, and I kind of know the answer to this question, but when you were going to medical school and doing all your your college stuff, and then, as you build up your education, is it fair to say, Dr. Jacobs, that in all your preparation and education that the topic of a pandemic never really was something that you would refer to in your notebook?
That is correct. That is fair to say. I think that the things that we're being asked to do definitely are varying. So for myself, for instance, I went to graduate school for a PhD in clinical psychology, and
right.
Our research, we focus on research and clinical training, and certainly, how to cope with something like cancer or another medical illness in addition to a pandemic was not something that we talked about. However, a lot of our training focuses on comorbid conditions like a medical condition in addition to a psychological disorder. So there are some skills that we can pull from, but I think to some degree we're all trying to reinvent the wheel here.
Dr. Jacobs, before we get into actually some of the things that you do and work with your patients, we understand up here that, of course, there's been different areas of the U.S. that have been hit hard by COVID-19. I understand that Boston was one of those areas. Have things subsided a little bit for the residents of Boston and you and your team a little bit more now that we're into 6 or 7 or 8 weeks of this pandemic?
What we're hearing right now at the Massachusetts General Hospital is things have started to plateau. And I think that what I'm seeing with my patients right now, and I'm fortunate to be able to see my patients virtually. Mm-hmm. I do individual psychotherapy with patients that are being treated for cancer at our cancer center or have completed treatment or are nearing end of life. And what we're seeming to see is that some of the novelty of this is wearing off. And of course, this was not an exciting time in a good way for people, but it was new and different, and people were figuring out how to live with it. And now what I've been seeing, like a little trend I've been noticing with my patients in the past week or two, is that the novelty has worn off in a way that people are now feeling the wear and tear a bit more. And the excitement maybe around creative ways to connect with others or creative ways to modify your activities is sort of wearing off, and people are finding it harder and harder to cope. And especially with the uncertainty, especially in cancer, they're dealing with so much uncertainty already around fears of cancer recurrence and whether treatments are working and what their next blood draw or scan is going to show. And now on top of it, we have a lot of uncertainty around what, quote, post-pandemic life will look like, and what will it end be, and will it be an end or a slowing of restrictions. And so that uncertainty is really compounded the uncertainty that patients with cancer are already facing.
Doctor, I'm curious because you actually touched on something. When you talk about dealing with your patients virtually, this is, of course, something new for all medical professionals. It's kind of an open-ended question, and I know you can't probably hammer it down in a short sentence, but is it becoming more, if you will, difficult to deal with people virtually, or kind of talk about maybe the comfort that people would feel on a one-to-one relationship and conversation in your office is now being done virtually? Kind of talk about that, because this is something I'm sure people haven't thought about.
Absolutely. I think that's a great point because I'm very interested to see what changes after this in terms of how we provide care. I think that this is something that is going to range and really, really range depending on the medical profession that's being, the type of care that's being delivered. There's certain types of care that just don't translate over the virtual platform where you really do need to have a physical examination for. Our therapy, we had already been doing for some patients virtually for those who were too sick to come into the hospital. I would say I probably only saw about a quarter of my patients virtually, though. Now I'm seeing all of them virtually, and what we found is that they're more able to participate. They don't have to come in to Boston, which is a big barrier for some, cost-wise and just time-wise.
Right.
They're much more able to engage weekly in sessions with me, which we see that for psychotherapy, weekly sessions are the most effective. When you start spacing sessions out twice a month, once a month, we don't see change as rapidly. So it's really great that they're able to engage because the barriers are minimized. And I've actually seen some new patients over that I've never met in person. And it's been working out wonderfully so far. So I think that some of our expectations about not being able to establish rapport or connect in the same type of meaningful way, we're sort of rethinking that.
So, Dr. Jacob, let's now talk about what you do, common stressors, obviously, for cancer patients. You're a proponent, and what you tell your patients, I know, is there's two ways of coping, problem-focused and emotion-focused. So I'm curious, Doctor, explain the difference between the two.
Sure, absolutely. When we think about coping is something that we all do. We all have been doing. We've been figuring out ways to get through life and stress. When we talk about problem-focused and emotion-focused coping, what we're really saying is let's break up how we think about stressors into aspects of a stressor that we can control, that we have some control over, and aspects of a stressor that are mostly uncontrollable, that there's nothing we can do to change them. Problem-focused coping approaches address those controllable aspects. And so especially in the context of COVID-19, we're hearing often, what can you control? Focus on what you can control. You can control the precautions you take. You can control if you socially distance, if you wear a mask, if you're wiping things down and washing your hands. Those are things that are in your control. Out of your control is what exposure you might have without knowing it, or the fact that you might have to go into the hospital at some point for treatment, even though that tends to be a safe place now with all the precautions they're taking. And so when we can't control something, we want to shift to using emotion-focused coping approaches. And those are things that just serve to reduce the stress that we're feeling. We've all had that fight or flight response, that stress response where you have a coursing of hormones through your body and you feel like maybe it's so overwhelming that you can't really get control of it. And so emotion-focused approaches are anything that someone finds to be self-soothing. Taking a walk, talking to a friend, journaling, any type of emotional expression, listening to music, taking a bath, taking just 5 minutes of mindful meditation. So anything that aims to reduce the stress when we can't control a situation, we want to use an emotion-focused approach. And anything that we can do to change a situation, get more information, talk to a medical professional to get guidance, solve a problem, or manage a conflict with someone, set a goal. Those are all problem-focused coping that we can use when we can control a situation and do something to change it.
Now, is it fair to say, Doctor, and we're talking, of course, about cancer, Dr. Jamie Jacobs, our guest, a clinical psychologist at the Massachusetts General Hospital Cancer Center. We're talking about cancer and how you deal with your patients, but is it too simplistic to say that what you just talked about, problem-focused and emotion-focused, can be used by anybody at any time, especially with this pandemic that's invading our lives?
Absolutely, Ted. This is a coping strategy that is based in models of stress and understanding coping and stress that go way back and can be used in the context of any stressor. And I'd also want to clarify that not everyone is feeling more stressed during this time. You know, this goes for our patients and also I'm sure for your listeners. For my patients, we've seen that some people feel that compounding uncertainty on top of their cancer diagnoses and treatment. Some of them feel like the world is closing in on them even more so, and that it's sort of a double whammy. But others, we've noticed, other patients of mine and people we've spoken to are saying, you know, I'm used to living with uncertainty. This has been my life, and they're accustomed to being isolated. I actually had a patient yesterday who said to me, you know, I'm used to putting my life on pause, but now the world has just paused with me. And so we also shouldn't forget that a lot of people are very resilient in the face of this. And for those people who are struggling a bit more, thinking about those emotion-focused approaches and problem-focused approaches based on what you can control and can't control is a good way to try to build up that resilience.
You know, Dr. B, before we wrap up, I'm sitting here smiling because I did go public a couple of weeks ago and said, and again, because of the work that I do, you know, constantly reading the updates about COVID-19 and what's happening, and I got to say what your president's down there, what your president is doing to upset people as well, all this stuff. I admitted it a couple of weekends ago that I had an absolutely horrible weekend, and then I finally sat down and did some self-evaluation, and I realized, Doctor, that in my situation, and I wonder if there are others as well, I realized what probably was bothering me was that the fact that I couldn't control the situation. I'm the type of person that likes to have a kind of everything laid out and know what I'm doing. And the uncertainty, and I realized this finally, is that was what was making me have a bad weekend. So I got to tell you, at least a little bit, I've kind of learned your problem-focused and emotion-focused response because it did help. But boy, I got to tell you, I had a rotten weekend a couple of weeks ago.
I'm sorry to hear that, but I love what you said, which is that you had to sort of sit down and say, this is what's bothering me.
Yep.
And I think that step is what, because life is so busy for so many of us, pre-pandemic and now especially, we don't often have the ability to sit down and figure out what's bothering us. We automatically jump to feeling anxious or feeling down and feeling frustrated and then acting on that emotion. If we all took a moment to say, what's really going on? What am I really upset about right now? Then we might be able to better react to that emotion. And it's not to say that emotions are normal and appropriate responses, but you might be able to better control how you handle those emotions if you realize first what's actually bothering you.
And Doctor, before we wrap up, we want to assure people, is it okay? Because we know that like we've seen with the graphs and the charts, the plateauing and the up and down, it's okay to have a bad day or maybe two in a row because of what's going on?
Absolutely. I'm glad you said that because emotions are a normal part of life, and having a bad day or a string of bad days is really normal right now. If you notice, though, that you're not able to get yourself out of a slump, that's when it might be time to seek some professional help. These are unprecedented times that no one has told us how to cope with, so we all have to be a little bit more open to accepting support, whether from family or friends or from mental health professionals. Knowing that emotions are normal and a range of responses is normal, and sometimes you could use a little bit of mindfulness to say, you know, this is really what I'm feeling right now, and I don't have to be judgmental or be down on myself for not going for a run today or being upbeat and cheerful. I can just say, you know, today is not a good day, but I don't know what tomorrow will bring, so I'm just going to be present right now, and then wake up tomorrow and figure out what tomorrow brings.
Doctor, I want to thank you for saying that because I've been a runner for over 30 years and, you know, as I get older too, I have to rest. But there's been times where I've wanted to get up and go for a run in the morning when I do. And it's like, you know what? I really don't feel like this. And then I get the battle, doctor. It's like yin and yang, left shoulder, right shoulder. Go for a run. I don't want to. Go for a run. No, I really don't feel it. Back and forth, back and forth. So I'm glad that you touched on that. So I should stop feeling guilty if I don't feel like going for a run.
Yes, the only way to make yourself feel worse is by berating yourself for not doing something. You're guaranteed to make yourself feel worse if you start judging yourself and berating yourself for not doing that thing.
Perfect. A fascinating look at how people
some freedom.
people are dealing with cancer. Dr. Jamie Jacobs from the Massachusetts General Hospital Cancer Center. Thank you very much. Hopefully, you and your staff and everybody down there is staying healthy. Hopefully, we can get through this relatively soon, and we can get back to whatever normal will be. And of course, that's another discussion for another day. Thanks very much for joining us. Much appreciated.
Thank you for having me, Ted.